I am gonna go ahead and get started. My name is Ashley Thompson and I work for Oregon State University as the Extension Fruit Tree Horticulturalist. And I'm glad we can be here today to discuss more about some packing house preparedness as well as workers with our partners from One Community Health, MCMC, the Next Door, Hood River County Public Health, North Central Public Health, and the Oregon Human Development Corporation. So I just want to give you guys a brief introduction to Zoom and how we're going to use Zoom today, especially for all of our folks out in the audience who maybe haven't been to one of our Zoom recordings yet. This will be recorded and you are all muted, so you don't have to worry if you're making a big racket in the back. We can't hear you. So the first thing I want to say is, again, you are muted, and if you're having some sort of problem, please raise your hand. If you're a panelist and you are not speaking, it's helpful to mute so that we don't get much feedback from the recording. When you would like to ask a question, you please use that Q&A box. I have it highlighted here in red, and that's going to allow you to ask a question. If it's a question that you're worried about asking, you can even send it anonymously by clicking the send anonymously box in the Q&A section. So this is going to be the best way to get your question answered and to make sure we see it. Sometimes stuff will go on in the chat and we might miss it. So the best way to make sure we're getting your question is for you to type it into that Q&A box next to the raise your hand. Don't use the chat unless you really want to tell us about a technical issue. Again, if you're asking a question in chat, it may get lost. So please use Q&A and don't use chat unless you really have to. And with that, I would like to turn this over to our panelists today. So we have Gail Bacon here from the Next Door, and she, One Community Health, Gail?
Yeah.
I'm sorry, from One Community Health. And Gail's going to be talking about really air movement and some best practices in packing houses and housing.
Good morning, everybody. I'll go ahead and share my screen here. Hopefully you can see my screen, yes? And
if we can see your screen, Gail, if you just make it full size, perfect.
yeah, is that it? Now I'll just make sure that my buttons move here.
Almost. So if you go up to the top, there's that screen with the little arrow in it. Click on that.
Are you talking this one up here, Ashley?
Yeah, on the top of your PowerPoint screen, just to make it full size.
Display settings. That's not it.
Oh, now we can see your presenter slides. You have multiple monitors plugged in?
I do.
Yeah, sometimes that can be the problem.
Okay. I can take my monitor out and see if that helps. Is that any better?
You're just going to have to go back to that slideshow view just because we can see your presenter slides right now.
Okay. See all slides. No. Don't want that. I don't know how to make them go away, Ashley.
Okay, just close out of this and just get your PowerPoint, bring your PowerPoint back up. All right, we'll try that again and hopefully this time it'll work.
Because normally I just go down here.
Yeah, that could work too.
This. Usually go here. Do you see it now?
Yes, that looks perfect. Hey, Sophia, can you do me a favor and mute yourself while Gail's talking just to make sure we don't get a lot of feedback?
Okay, so let me just make sure that works, and it does. Perfect. So we're going to go ahead and we're going to talk about some airflow in enclosed spaces today, because that's what you get a lot of in the packing plants. And the first thing we want to talk about is making sure that you have as much fresh air as possible coming into the building. That's going to help those air exchanges. You don't want stagnant air. So if you're able to open windows, doors, and vents to the outside. Now, my understanding is within the packing plants, you've got some regulations around, you know, food handling, and you don't want bugs and all of those kind of things coming in. So certainly screens on those doors or windows are a helpful thing if you can do that. It's also a great thing if you can work in rooms with really high ceilings, because again, there's just more air into the room. If that's a possibility, then that's great. I know that sometimes that's not always possible. So fans generally should blow from clean to dirty. I know it gets really hot at this time of the year. We're trying to keep the workers cool. So fans are a great thing. Ice packs on necks and stuff like that work well as well to keep people cool. If you do have overhead fans, you should try and circulate them up. So what I mean by that is that the air gets pulled up and out as opposed to pushing down. It's not the end of the world if it pushes down, but again, we're trying to pull the air out of the room and up. Some of the packing plants actually, I think, have exhaust fans on the top. So if you have those as well, certainly turn those on so that you're exhausting or pulling air out of the building and pulling fresh air into the building. If you happen to put fans in windows or doors, try and put them outside, point them outside. So again, we're pulling the, I'll call it dirty air out and sucking the clean air in, if you will. Ideally, if you had it set up, you would open one window and have a fan pointed outside of the other window so that you're pulling that air through and exchanging all of that air. Air conditioners, biggest thing about them is making sure that they're pulling in fresh and not recirculated air. Most HVAC systems are pulling in fresh air, but sometimes you can go into their settings if you have a really sophisticated one, and you can say open up the dampers in the HVAC systems to pull in more fresh air into the system. If you have a wall unit, sometimes there's a toggle or a button where you can say, I want to recirculate or I want fresh air. So always turn it to the fresh air one. The other thing about air conditioners is you need to change and clean your filters on a regular basis. If you're not changing and cleaning those filters, all those bugs, the molds, the dust, the pollen, all of that is getting caught in those filters, and then they're not efficient at doing what they're doing, and then that encourages more bugs to grow, which gives you other issues as well. So always make sure you're changing your filters. Just some air cleaning technologies that are out there, in addition to the fans, is you can put HEPA filters on air conditioning units. You can put ultraviolet germicidal irradiation or UVGI. Those are technologies you can look at. You can look at bipolar ionization. And those are all ways to clean the air. Sometimes you can get those in portable units that you can put into the room. You just need to make sure that the unit, it fits the size of the room. So for example, if you had a room that was, 500 square feet, you need to buy a portable unit that is capable of cleaning 500 square feet. And so if you buy a unit too small, then it can't keep up with changing the air or cleaning the air in that space. Just some other COVID safety. I mean, you've heard this over and over again, especially when you're indoors. Wear your mask. It's source control for those droplets. We want to stop those droplets from even getting into the air to begin with. So absolutely wear your mask. Try and do the social distancing to keep workers at least 6 feet apart. And if you can't keep them apart, put up barriers if possible. We always want to keep them apart. But again, if they have those masks on, the distance is not as critical, but it's still a good idea. Again, hand washing, especially if people are touching their masks. And once you touch your mask, you've got dirty hands. So you need to think about what you're touching next. You know, are you rubbing your eyes? Are you touching a computer keyboard or something like that? In which case you touched it with dirty hands. So the next person that comes along is going to get that same dirt on their hands. So you want to make sure that you're disinfecting those high touch surfaces such as the computer keyboard. So in a nutshell, that's a little bit about air, and I'm happy to take some questions. There's some sources on the CDC that gives you some backgrounds on environmental stuff, as well as some information on some cooling centers, which was actually interesting and appropriate. So like I said, happy to take some questions. I'll stop sharing.
So Gail, what role do face shields play in this? Now, can we use face shields in place of a face mask?
Great question. So face shields do provide a degree of protection. Absolutely. They put a shield right here. So if you wore no face mask at all, it certainly would give you some protection. So the spit coming straight out would be deflected. But the thing with a face shield is a lot of them don't have side coverage, bottom coverage, and some of them don't have top coverage. So it allows, like if you sneezed or something like that, it allows stuff to get out easier than from a mask. It allows that stuff to get out around the face shield easier. So it does provide a degree of protection, but it's not probably as high as a cloth face mask. And then a surgical face mask is higher. And then of course your N95 is even higher than that. So I also say that if you are dealing with somebody else who for whatever reason is not wearing a mask, you know, I can come up with a million reasons. You would more likely want to wear your face mask and a shield, whether that's a face shield or goggles to protect your eyes. Because if that person has no source control, in other words, there's nothing stopping the spit from coming out or the droplets getting into the air. Droplets can potentially get into your eyes or on your mask. They're easier to get at you. So it's an extra layer of protection when somebody else working with you doesn't have a mask on. But for, like I said, everybody should be having a mask on in the workplace if they're working with one another at a minimum.
So you mentioned really briefly barriers. Can you describe some barriers that you think would be really helpful in a packing house situation and what your recommendations are at this point?
Sure. What works well is you can get plexiglass barriers. You can also, and you want barriers that you can wipe clean. So you could also put up like a clear shower curtain because that would be easily wiped off. But you wouldn't want to put up a cloth barrier. It is a barrier, but it's harder to clean. You would have to launder it. So you definitely want something that you can wipe off easily, like a plexiglass or, like I said, a plastic shower curtain or something along those lines.
So I noticed there's a lot of packing house folks here today with us, but there's also a lot of folks that have worker housing. Do you have any airflow recommendations, particularly for worker housing?
Yeah, for sure. When we've toured some of the housing in the past, you want to make sure, well, first of all, you want to, if it's a family unit all living in the same house, that's one thing. But if you have workers that have been placed together in the same housing, you want to try and keep them 6 feet apart, put the beds 6 feet apart, but also open the windows so that you have that airflow circulation. If you can have a fan in there, definitely put a fan in. You just want to keep that circulation moving and be very careful. Some of the units do have air conditioners in them, which is great. And on these hot days, you know, is really necessary. But some of the units might be older units. So it may be that you turn the air conditioner on, you cool it off a little bit, but then you've got to get some airflow going through there, because some of those older units they don't bring fresh air in, they recirculate the air. So you've just got to be careful and mindful about that, to open up a window, open up a door, let some fresh air into the room. That's the biggest thing.
So Gail, I've got a grower question here. How tall should those barriers really be, either within the packing house or in worker housing?
Probably in the neighborhood of, about maybe 4 feet, 3 feet. It depends if the worker stands to do their work or is sitting to do their work, how high that would be. Usually you don't want it all the way up, because actually you'll stagnate airflow if you get too high. So if you work in a room that has a lower ceiling, you don't want to go up any higher. If I was sitting at my desk, I wouldn't want anything that's higher than 5 feet, because if you make it higher, you actually stop the airflow above you from moving. So you want to have, like I said, maybe 3 or 4 feet, because you're just trying to protect the spittle from coming out, right? And that's all you're trying to do. So don't make it really super high, because you actually stagnate air when you do that. You prevent it from flowing and getting out of the room. So I would say in the neighborhood of maybe 3, 4 feet high.
So a lot of our folks will be standing and packing lines. How high should it be then? And that
right.
maybe
so,
sometimes depend on how tall the worker is too. Like
exactly.
Because I'm 6 feet tall.
Yeah, so if you have workers that range in height from, I'll just say 4 to 6 foot tall, there's 2 feet. So I might add a foot onto either side and say it's 4 foot, but really that 4 foot needs to be 4 foot up in the ground. So let's see, I would probably have to say, it's probably 3 or 4 feet off the ground before you put that plexiglass up. Does that make sense? Because my face is standing up at the 5 foot or 4 foot level, whatever. So you would you would use your common sense to make sure the plexiglass is covering most of their facial area, right?
So maybe it would be like a 3 to 7 foot like shower curtain hanging or something like that.
Yeah, you can do the shower curtain. Yeah, absolutely. Again, you don't want airflow to stop. So you've got to be careful when you put those barriers that you only put the barrier sort of where you need it, not the whole section, because again, you stop that airflow. You want to have good airflow. So you don't want to stop that. You're just trying to stop the spittle from the droplets coming directly at you. So, so yeah, you just have to be creative. It might be that you're hanging it from, strings or rope or chains, whatever, from the ceiling. And so you've got these ropes coming down, and then you've got your barrier, and then you've got nothing below it, right? So it allows that airflow to happen. Hopefully that makes sense.
I think that makes sense. Does anybody have any more questions for Gail? Everybody's being super quiet this morning. You can ask questions anonymously. Well, Gail, I'm sure we'll have some more time for questions for you. Oh, we got one. Are health checks effective? So I'm assuming when we're talking about health checks, we're talking about maybe some temperature checks and having people fill out a questionnaire. Can you tell us if those things are effective? And Mike Matthews from the health department, if you want to chime in, you can also let us know your feelings about health checks.
They can be helpful. However, not everyone experiences the same symptoms. So one person may have a fever, and that's so that you would catch that if you were doing that as a health check, but there can be people that don't have that particular symptom. So I wouldn't say it was a bad thing to do. It gives you a base line to monitor your employees if you want to do that. what we really recommend is that if they have any kind of symptoms at all, that they stay home until those symptoms clear. Because we've seen anywhere from folks with no symptoms to people with just a headache. So there's a huge variety of symptoms. So if you're not feeling well, please just don't go into work until you're feeling better.
And I would just add and say, you know, the symptom checks and the questions are another layer of protection. You know, we're trying to put all these layers in, and all of them help in some manner. So together they give us a package deal, so to speak. So you're never wrong to ask the questions. And it's interesting to me that sometimes people don't think about their health until you actually ask them. Because their focus is, I've got to get to work and I need to be productive. And so when you stop them in their tracks and say, so how are you feeling today? And hey, you look like you're not feeling well, or did you sleep well? Are you having a cough? It looks like you got a cough there. When you point those things out to people, then they actually open up.
Yeah, that's a great point. I would recommend that if you do want to have a protocol like that, that you ask specific symptoms. So our contact tracers have found that if you ask someone, how are you feeling today? Most of the time they'll say, oh, I'm fine. But if you say, do you have a headache? Do you have body aches? Do you have a cough? Then that'll trigger something where they will remember or become conscious that, yes, I do have a headache, and it's, you know, I've had it for 2 days or whatever. So asking those specific questions can be very helpful.
So temperature checks in particular, there's something that there was a lot of interest around early in the pandemic. Are those still really useful tools? What are your thoughts?
Well, like I say, and as Gail said, it is another layer of protection. However, not everyone will present with a fever. So we have a lot of folks that we have been talking with over this pandemic that have never experienced the fever. So just because you don't have a fever doesn't mean that you don't have COVID.
So one of our orchardists here wanted to share their experience, and they said that the workers are less likely to risk it coming to work with symptoms if there's one of those health checks in place. So I think that's good to point out as we come upon pear harvest, that that's something people might want to institute. And there is a tool that OSU and North Central Public Health made to help with those screenings. So again, we can always revise that because we're finding more and more symptoms of COVID that we didn't know existed back in March. So do we have any other questions for Gail at this time? Give everybody a second to think about it. Well, again, I'd like to thank you. I think it's really important to think about those barriers, and some of those things are really difficult you know, to institute or to think about on the fly. So it's really helpful to learn more about airflow and barriers from you here today.
Absolutely. Yeah. I think it's, we have our theory of what we want to happen, and then we have the reality of how are we actually going to implement some of those things. And I think that's the piece that I'm happy to have conversations and come up with solutions for some folks, because sometimes they're just like, I just don't know how to even make that happen. And so this is where we got to get creative in life, right?
So if somebody that's like a packer calls you and asks for some sort of consultation, are you able to go out and take a look at the packing houses, or do you need pictures? What sort of services is One Community Health offering in that way?
Yeah, I can let Gladys address that a little bit more, but yes, we have gone out. If a packer wanted to have that service, we have gone out, we have done assessments and given some recommendations about what they could potentially do for various areas. So it is a possibility. It would just be a conversation. And like I said, I'm sure Gladys will tell you a little bit more about that.
Definitely. We'll talk to Gladys a little bit later today. Sophie, would you like to share your screen and talk about the programs the Oregon Human Health or Human Development Corporation has been working on?
Yes, let me get in here, share my screen. Okay. All right, can you see my screen?
Yes, we can. Just make it full screen for us, Sophie.
Okay, is that full screen now?
Nope, go up to, you can go on to the bottom of the page and there's that like presentation, that presentation mode thing at the bottom. It's like 303 to the right from where your presentation currently is on that bottom of the slide set, or you can use the top. There's.
There it is. Okay,
Perfect.
are we good now?
Yeah, looks great. Thank
Okay.
you.
Yeah. Yeah, so my name is Sofia Velasquez. I am the Safe Sheltering Coordinator for the Oregon Human Development Corporation. And I'm excited to talk to everyone today about our Safe Sheltering program. This is a program that has basically been given to us by the Oregon Housing Community Services. So they allocated $3.5 million of emergency state funding to provide safe sheltering to Oregon's migrant farm workers. And so a little bit about the purpose of this program. I kind of briefly mentioned it. So it's to provide safe sheltering to Oregon's unsafe and unstably housed farm workers and their families with the use of hotel motel vouchers and with the support of some subrecipients in and around OHDC locations throughout the state. Applicant eligibility. So for the program, you have to be a farm worker or farm worker adjacent. And farm worker adjacent, Oregon Housing Community Services has been really flexible in that they've allowed us to define what the word farm worker means. So as of now, we are including folks that work in food processing plants in that definition, as well as people who work in like the seafood industry. So that's pretty amazing that they've been flexible in allowing us to do that. You also have to have to be eligible.
Hey, Sophie, we're having some issues with your audio here. We can't hear you any longer. Sophie, are you there?
I'm excited to talk to everyone today about our safe sheltering program. This is a program that has basically been given to us by the Oregon Housing Community Services. So they allocated.
Sophie's experiencing a couple difficulties right now, as I'm sure you guys could hear. So I'm going to give her a chance to fix her internet connection. And for now, maybe we can hear a little bit from Gladys about the One Community Health Education program that they've been offering orchardists.
Hi, good morning, everyone. My name is Gladys Rivera, and I am the Preventative Health Manager here at One Community Health. We are offering on-site education for growers. You could be a grower, you can be a packing house owner. It doesn't matter. We can come out and we can give you and your employees some education preventative measures for COVID-19 and best practices. We are also offering farm worker health clinics that take place on Wednesdays. And right now the series has moved up to Parkdale Elementary, where we will be every Wednesday afternoon from 5 to 7:30. Folks will have access to a provider. They will have access to COVID-19 testing materials, and also we can assist with food, masks, and hand sanitizers, as well as some of these resources, for example, the Oregon Workers Fund and the COVID-19 Safe Shelter Program as well. We also make virtual visits available so we can give out information on how to do that. We have our website, onecommunityhealth.org/orchardist, where you can find all this information that I'm talking about right now, how to sign folks up for the Farm Worker Health Clinic if they want access to testing, virtual visits. We also have Orchardist frequently asked questions on our page. We provide the education material. A lot of it is on our website. If you have any questions, please call our clinic, and that is 541-386-6380. And you can ask to speak with me, Gladys Rivera, and you can be transferred over to me and I can answer questions. Or you can email us at employerquestions@onecommunityhealth.org, especially for you growers who have some of those airflow questions for Gail. But as she mentioned earlier, we do offer on-site consultation where Gail and myself go out to your facility and we just help you identify high-touch surface areas and ways to navigate better, especially with the conditions that we are in right now. All of our information is on our website. Please feel free to call and email me, and I can get back to you guys as soon as possible.
So Gladys, can you talk a little bit about what that on-farm education entails? I think a lot of people don't realize what exactly you're doing, and that may be why we haven't seen so many folks sign up for that. It's a really great resource.
Absolutely. So in our education, we go over what is COVID-19? What are the signs and symptoms? Why we wear a mask and the importance of wearing masks, and what does physical distancing look like and the importance as to why. What makes this training great is that it's the method that we teach is popular education. So we have a lot of visuals, a lot of props that we don't hand out, but we touch them ourselves so that folks can visually see what we're talking about. And it's simply, they comprehend a lot better than to just hear this information on the radio. And we're practicing it within the work environment. So they start getting to know these are high touch surface areas and I should carry my hand sanitizer with me. We can offer masks for individuals and we show them how to don and doff a mask, how to put it on, how to take it off, how to hand wash your mask, the difference between a KN95, a cloth mask. So we just go through all of the information with your foremans, your managers, and overall your employees, so that hopefully they take this home and they continue to practice it and they continue to have these conversations within their household, because we want to normalize this. These are the precautions that we have to take, whether you're in the workplace environment, and then of course when you're out in the community, that we still want folks to put their masks on, practice safe distancing, washing their hands, and of course staying home when they're not feeling well.
So Gladys, about how long does this training take so people can plan that into their training schedule?
Usually the presentation itself is pretty short. It's about a half hour long, but we have questions, so it can take to about an hour. The longest we've ever had it is about an hour and a half, and that was when folks really had a lot of questions. This was a couple months ago. So usually we can get it done within an hour's time. The classes that we've been teaching now have either been first thing in the morning or later in the afternoon, so at 8 o'clock or at 4 in the afternoon by the end of the day. So we're very flexible. We usually do this education Mondays and Thursdays. If you let me know ahead of time, you know, a week or two in advance, we could accommodate to make a Tuesday, a Friday, even a Wednesday morning, but primarily we like to stick to Mondays and Thursdays as we do have patients that we see on other days of the week.
I'd also just like to reiterate that this is a free service that One Community Health is offering to orchardists in our community. And you know, you have the opportunity to have healthcare workers actually come out and do these trainings, which is, you know, great because they're incredibly knowledgeable and they've been doing this health education for a very long time. So it's a great opportunity. It's free and people can learn a lot from Gladys and from her team. Do we have any questions for Gladys about these trainings or what these trainings might entail? So Gladys, there have been some concerns that it's a liability to provide these trainings, especially if you're an orchardist, because you're not a medical professional, that orchardists aren't a medical professional. So there's been some worries about kind of telling your workers medical information or having somebody come in and give your workers medical information if you're not a medical professional and you're an orchardist.
So the information that we give is recognizing the basic signs and symptoms that we know are available. We're, you know, not giving medical advice. And if there is a situation where you do need medical advice, then we do have staff available to make that suggestion to you. What we're doing is, you know, basic practices that, or the information that everyone has now that we have the access to or the ability to have access to. And that's really recognizing what is COVID-19, the basic signs and symptoms. We're just giving that basic information. It's not medical advice.
Thank you. There's also some concerns about HIPAA violations.
HIPAA violations.
Yeah.
Well, we do not talk about patient information as we are giving this information. For example, a grower can contact me and give me all the information about their employee. They can give me, you know, dates or birth dates. That's fine. But I, as an agency, we cannot release any information. So that we do practice that. If you send me, I would like to get these individuals tested, that's fine, but I can't give you any information back on so-and-so tested positive or negative. We do have a release of information flyer form that your employee will sign if they want to release information to you. So we do offer that to make sure that you have the grower information in regards to, is this individual positive or negative? And I also believe that when an individual does come up positive, that the health department would be reaching out to the grower if it's identified as a workplace outbreak to do contact tracing. So we do not release any sort of information about any patient ever, unless we have permission from the patient to do so.
Thank you so much, Gladys. Do the growers have any questions or packing house folks have any questions for Gladys? Like I said, this is a free opportunity to get healthcare education to folks. It's probably a really great way to prevent potential outbreaks. I don't know if you guys have data for that, Gladys, but it seems like it would be a really great way to prevent outbreaks.
The importance is just offering the education, and it's coming from a healthcare agency as opposed to the employer, which sometimes folks take that advice better because we are a health agency as opposed to the owner or the grower. You know, I'm sure that the grower themselves does not want to limit that family barbecue on the weekend, but if individuals don't understand the importance of not being able, or at least just wearing a mask if you're going to do so, again, it comes better from the health agency as opposed to the grower or the owner of the facility.
I just want to point out again that this is a free service and you've received several emails about it now at this time. So if you just click that link, or in several of the emails, I have Gladys's address and phone number, email address and phone number. If you want to get in contact with Gladys and with Gail, I really am promoting this. I think it's very helpful to workers and also to growers. So please consider using this service. Talk to some of the growers that have used it. I know Mike Oates has used this service in Hood River. I know Dane Clint used a comparable service with MCMC in the Dalles, and he would like to use One Community Health's services in Hood River. So it's a popular service. So will this service be available after cherry harvest as well? So if you're in the Dalles, can you use this after cherry harvest?
Absolutely. All you have to do is call me, and we just have to make sure that we have time on the schedule to get you on, but we can go back to Wasco County. That's where we have been conducting this education, and now moving into Hood River County as the season is starting here. But we're very flexible to be able to accommodate whatever need as far as geographical location.
And nobody likes when I say this, but COVID doesn't look like it's going away anytime soon. So this might be something, you might be finished with cherry harvest, but maybe you want to invite Gail and Gladys to your orchard or to your packing house to see the buildings and talk to them a little more about how to make improvements for next year. So keep that in mind. Thank you so much for being here today, Gladys. An invaluable service you guys are providing to our community here.
Thank you for having me. The last thing that I want to mention to you, growers and packing house owners, right now is the time for each and every one of you to let your employees know what sort of services you as a grower, as an organization, offer in regards to sick leave, paid time off, whatever your internal policies to support that. Right now is the time to let people know that it's okay to be sick and that there are services and resources available to help them during this time. Thank you so much for having me.
Thank you so much, Gladys. So Claire, are you going to finish Sophia's presentation by any chance?
Yeah, hi everyone. I am actually just going to go ahead and pull up her PowerPoint on my screen. If it's okay for me to share my screen, Ashley. Great. Can you see that full screen?
Yes, we can.
Awesome. And what we're going to try, because Sophie does have so much more information than I do, is I have her here on the phone. So I'm going to go ahead and try to have her give it the presentation from my side. And Ashley, maybe you can let us know how the sound is working. Okay, 1 second. Okay, so it says on feedback and we'll put it on speaker. Go for it, Sophie.
Okay. Can everyone hear me okay?
Yes, we can hear you, Sophie.
Okay, I do apologize. We're having technical difficulties and our internet is down. So where did I leave off? Should I just present it all over again?
I think we are right here at applicant eligibility.
Okay, so to be eligible for our safe sheltering program, like I said, you have to be a farm worker or farm worker adjacent. Oregon Housing and Community Services has been really awesome in that they're flexible with us and allowing us to define what farm worker adjacent means. And the word farm worker itself. So we've included folks that work in food processing plants and work in the seafood industry as well. And they also have to have a compromised health status or elevated risk of infection or vulnerability to impacts to health that are related to COVID. And additionally, there is a housing status requirement. So they have to be homeless and risk of homelessness, other federal homeless statutes, fleeing domestic violence, or unstably housed. And there is that side note there. So working or living in a farm that has to abide by OSHA regulations. So just to give you an example, we have been housing folks that are staying in cabins at, in the farm where they work. And it's not that they feel unsafe in the cabins, they just prefer to have, a nice hotel room and there more space with AC. And so that's also something that we're allowing for this program. So even if they do have housing and it isn't a nice cabin, if they want a hotel room, they can definitely qualify for our program. And one of the coolest things about our program is that there is no income requirement. Other OHDC programs do have an income requirement, so this is awesome that we don't even have to worry about that. And can go ahead and move to the next slide. So some key points to our program, like I said, there's no income requirement. Urgent care needs, so like phone, transportation, and emergency health services if no other options are available. And another awesome thing about this program is that self-certification is allowable when there are no other forms of certification. So if they don't have an ID, they can self-certify themselves. And that's something that we have done, and it's worked pretty well on our end. So program-specific eligibility criteria. So for this program, you have to at least meet one of the criterias listed here in this slide. So loss of employment or income due to COVID, related factors directly impacted by a business closure related to COVID, diagnosed or exposed to COVID, or compromised health status, or elevated risk of infection or vulnerability to health as related to COVID. Most of the folks that we've helped house have been, are just exposed to COVID, and to keep them, safe and give them a more safer housing option, we, give them access to a hotel. So we haven't had anyone that has been diagnosed with COVID or has directly, been impacted by a business closure. So that's kind of more of a demographic that we're working with is people that are out and that are vulnerable and that need housing. And here's just for your own, if you want to read through definitions of what exactly safe sheltering means, or what it means to be unstably housed, or client direct services, there's just more in-depth definitions there. And that's all I have.
So Sophie, if folks want to get in touch with you, what is the best way to do that?
Sophie, so the question was, if folks want to get in touch with you, what is the best way to do that?
So the best way to contact me is via email. I'm pretty fast about responding to emails, but you can always feel free to give me a call as well.
Ashley, are you able to put Sophie's email there in the chat for everybody, if that's okay?
I don't have it.
Yeah, that's perfectly fine.
Claire, but Sophie, if you can put that in the chat, I'd really appreciate it.
Or yeah, Sophie, if you want to go ahead and do that, if you have it up still, that would be great. Yeah. Is there a phone number that people can call as well, just even for like a local Hood River office, or how would they, like if a farm worker doesn't have access to email, what would be the best way to get enrolled in the program?
Yeah, so our flyer has a number attached to it that folks have been calling, and that's our central location. And then depending on where the client is located, then we kind of, filter it through and send them to the correct OHDC office location. So I can send everyone out our flyer, and I can, put my number and my email here in the chat box as well.
Thank you.
Claire, do you have anything to add about that program, or anybody else? Jess, I'm not sure if you have anything to add about the program.
I don't have anything immediately other than that it's been a really great program, and they have housed over 50 people in Wasco County at a time that was really needed. So we've already seen like successes that have happened to address really urgent needs. And we know that that may be needed here in Hood River County. So we're really grateful that OHDC and the Next Door are partnering on this program, and really encourage growers on this call to make this resource known to your employees, and to use this resource as well. We've heard from some growers that due to new OSHA regulations of housing, having to cut down your workforce, and that is challenging for everybody involved. And so we're really grateful to OHDC for this program to offer an alternative to that. So Sophie's been working really hard all across the state. We're really grateful she's here today to talk about it, and encourage folks to reach out with questions.
Does anybody have any questions right now for Sophie about this program? All right, now I'd like to just open it up to all of our panelists that we have here today, in case there's anything that anyone would like to share with our growers and packers here in the region.
Ashley, there's just one other resource that I would like to mention, if that's okay.
Yes.
Great. So I work at the Next Door, along with Jess Smith, who's also on this call, and Paula Escobedo, who's also here. And one of the resources that we are able to offer right now is a statewide program known as the Oregon Workers Relief Fund. So you heard Gladys mention it very briefly in her review of what they do over at OCH. But I just wanted to go into detail a little bit about that. This is essentially a fund that has received money throughout the state for unemployment insurance for folks who don't have access to that federal aid due to legal status and other barriers. And so we know that this is a challenge in our community, in our state, and that it ripples out to affect everybody in our state. And so this has been a really incredible program that has been working and able to assist people at this time when so many people are losing wages due to COVID, both in the agricultural industry and in other industries. So this, in order to access this fund, you would have anyone you know or any of your workers call the Next Door, and I will put the number here in our chat box. To qualify for this, there's several different qualifications, and I do not work specifically on this program, so I cannot speak to exactly what all of those are. But we have several staff who are able to help navigate people through that application. So this number that I will put in the chat box will bring people to a voicemail, and then we have bilingual staff there to help people with that. So we know that one of the biggest fears that people have in reporting symptoms or reporting close contacts is the loss of wages. Which is so true for so many of us, that is a strong motivator. So like Gladys said, really elevating the resources that people have in the community so that you can help keep your workers safe is something that we ask of all of you, because we know that is going to keep you, your workers, your operation all safer and with better well-being. So this is a really great resource here that's local. And I'll go ahead and put that number in the chat. And if people have questions, feel free to ask. Thank you, Ashley.
Thank you so much, Claire. It looks like Mike would like to add some information to the conversation.
I just want to really thank all of our folks out there in the agricultural community. They've been extremely supportive and done a lot of work to try to protect their workforce. Don't hesitate to give us a call here at the health department. We have all kinds of resources available to help. So please reach out if you have questions, and keep up the good work. We very much appreciate everything you've already done.
Thank you so much, Mike. Does anybody in the audience have any other questions? Seems like everybody's been really quiet today. Well, I would like to thank all of our panelists again for joining us today, and everybody in the audience who signed up for this webinar. I really appreciate having you, and please feel free to reach out to myself, to Claire, to Gladys, to Sophia, to Mike, Matthews, if you have any questions about anything you heard here today, or if you have just questions as pear harvest is quickly coming upon us and cherries are wrapping up, but you might want to have some assistance post-harvest. Great, thank you all for joining me.